Hello, everyone. My name is Sue Paul. I'm the Senior Director of Wellbeing and Brain Health for Asbury Communities, and welcome to this month's episode of Ask Asbury. June is Alzheimer's Awareness Month, and today I am so honored to welcome Mike Brown, the Director of the Future of Aging team at the Milken Institute. Mike, thank you so much for being here today.
Hi, Sue. Thanks for having me.
Yeah, so tell us a little bit about yourselves. I know I've had the honor of knowing you for a short while, and I'd love everybody else to get to know you too.
Yeah, we're happy to have you as part of our Alliance to Improve Dementia Care. I'm about 18 months into the role at the Milken Institute now. And about 12 years into my career, I started in pharmaceutical and healthcare marketing at St. Joe's University and really loved tying business principles to the healthcare industry. Then I went to Johns Hopkins to get an MBA in healthcare management, really to understand the stakeholders of healthcare. Started at a Care First Blue Cross Blue Shield company, understanding how the insurance world of healthcare works, and then fell in love with brain health. I have to credit my brother, who is studying to be a neurologist now, and we started to dive into Parkinson's disease and what is non-invasive brain stimulation. And so I took a plunge onto a startup and was director of business development at a startup doing digital cognitive assessments. So ways to look at very early and subtle signs of disease through all these powerful computers we have in our pockets of a smartphone or a tablet. And we were working with pharmaceutical companies in clinical trials there. And then I found my way, worked my way to the Milken Institute. And now I get a little bit more involved in the policy and the economic side of brain health, Alzheimer's, and dementia care, leading the Alliance to Improve Dementia Care.
Well, that is certainly a valuable background for all for the science community to get to benefit from your business acumen also. So I've been a big fan of the Milken Institute for a long time. And I'm so happy to have this like direct relationship with with it now. But can you tell us what the Milken Institute is and your focus on the future of aging team?
Yeah, absolutely. The Milken Institute is a nonprofit, nonpartisan think tank. So we like to think about big problems, but try and take a middle road to it and bring all the stakeholders needed to solve the problem to the table. So a lot of times in business, you're very singular mindset on your customers, on your line of business, but you don't know the downstream impacts. And if you bring the right voices to the table that maybe were not in the decision room, they might have a perspective that would be very valuable to you. So the Institute likes to work in an area called venture philanthropy, where we are a nonprofit. So we work with foundations, benefactors that want to give in an area but aren't the experts in that area. Maybe a parent had Alzheimer's disease and they want to contribute to the space. We would work with them to say, these are the great organizations doing great work. If you want to make your money go further, contribute to them. And so we function across finance, philanthropy, and health. I sit in our health pillar, which really works on public health, economics, and specifically on the future of aging practice. We think about aging and longevity, which a big part of that is your brain. And so it's not just enough to live as long as possible. You need to do it healthy, which we call health span. And what's the point if you don't have your wits about you? So brain span is that crucial keystone within that. So it's been really great to think about what are the challenges with Alzheimer's and brain health? Where are we at as a field? What is going to continue to propel us forward? Which I'm excited to talk about a couple projects I'm working on.
Oh, I'm going to let you get to that. But first, can you tell us about the Alliance to Improve Dementia Care, which I am a new and very proud member of? But tell us what that is and what you're working on.
Yeah, I was happy to land here at the Alliance, started by Diane Ty and Nora Super about 6 years ago. And in 2020, it was really founded as conversations within Medicare were happening around coverage programs for comprehensive dementia care, which some people out there may be familiar with the GUIDE model. So, Guiding an Improved Dementia Experience is now an innovative model that the Center for Medicare and Medicaid Innovation, CMMI, has composed. And so the Alliance came together to say, what does good dementia care look like? What is comprehensive dementia care? What are those pieces within there that some organization could put together to say, yes, we offer a great dementia care experience? One of those things that the program developed was care navigation, that you need to actually have someone that's clinical adjacent bringing together all the parts, as this is a very socially demanding as well as medically demanding condition. And so that was important, as well as recognizing the caregiver. So what the program does is it recognizes that you either have a family caregiver or a professional caregiver tied together with the person living with these conditions, and we need to educate that person on what to expect and how can you fit the home with a better environment so that your person and loved one is able to live in this other new world where the brain's not working as it normally once was. So you interpret things a lot differently. So how can we jump ahead of some of those potential misinterpretations? And now we've expanded our aperture a little bit. So we're following the guidelines of something called the National Alzheimer's Project Act, NAPA. So they expanded into another goal 6, where you look at brain health, risk reduction, and prevention. And my understanding was previously prevention in this dementia brain health world was taboo. You couldn't say any of this could be prevented. Now we kind of understand there's phases to that where you can prevent in a very subtle symptomatic population. You can use treatments to prevent further onset of disease. And so we are getting a little bit more used to prevention in Alzheimer's. And so we work at the healthy lifestyle risk reduction phase. We're looking at early and accurate diagnosis. And then after diagnosis, we want to make sure that you have access to great services.
Yeah, these are all my favorite buzzwords that you just used, from longevity and health span and even prevention of Alzheimer's. I know I've lived through that whole evolution of what's taboo and what you can say, but we are getting better at defining what I think what those, like you said, like those subtle, nuanced moments are that are meaningful and impactful, and you can really make a difference just through lifestyle interventions and things. But so anyway, what else are some new and exciting developments in the field of Alzheimer's and dementia care? I know you have your finger on the pulse of a lot of fun things.
Yeah, absolutely. It's been tremendously exciting and rewarding to see the field have this renaissance in neuroscience. And it's generated mostly because we have better instruments to understand what's going on. So within Alzheimer's, the clinical trials had 99+% failure rate because they weren't really recruiting the right patients for the drugs that they were trying. So that when they looked back and said, why did this Alzheimer's drug, we were targeting amyloid, why did this drug fail? Well, they finally were able to actually scan people who had amyloid, and they found that only a subset of the people in the trials had the right proteins that they were targeting. So now that we have better access, widespread PET scans, which is a way to detect more of a higher image quality on amyloid and tau. We have cerebral spinal fluid, so you have protein breakdown and it ends up in your spinal fluid, so we can test that way. But a paradigm shift now is blood tests. And so with ultra-sensitive technology, we can show and find proteins floating in your blood that are coming off of these hallmarks of Alzheimer's, amyloid and tau proteins, and get an indication of saying, okay, you have cognitive impairment symptoms. We are also seeing these proteins break down. We're very suspicious of Alzheimer's here. We're going to continue to look at that. Or you could rule it out and you say, okay, you have impairment here, but we've ruled out Alzheimer's. Let's look at something else. Is this a quicker reversible treatment? Is this more of a frontal temporal dementia or a Lewy body dementia or vascular causes of impairment? So it's really exciting to get more granular on this. You might hear this word dementia, and it's many, many diseases. It's a
Mm-hmm.
condition of functional impairment caused by these diseases. So the more we can get specific around what disease you have and empower patients to continue to ask, oh, my doc's saying dementia, can you define that a little bit more? Can we get specific there? Because then we can better understand what your prognosis is, what you're likely to experience in the future, and you can help prepare. Do I need to prepare quickly? Do I need to how aggressive should I be with this? Is this something, relatively normal that I can wait out? And so it gives us an ability to understand what we're dealing with. I think the other cultural shift is just to continue to understand that these things are not normal aging. And so when you survey a population of is dementia, cognitive impairment normal, most will say yes, unfortunately, today. They will still think that this is getting older.
Hmm.
And while even the cognitive decline has shown that it does not have to happen as you get older, even subtle cognitive decline. So it is not normal. There are things you can do every step of the way. There's a reason to know, and there's things you can do. And so those messages are what we need to continue to get out to doctors, to patients, to health systems, to payers, that it's time to start looking, it's time to start to be aggressive, because the whole system can benefit.
Yeah. So those blood tests are really exciting for a lot of reasons, but that spinal fluid, like the spinal taps are not pleasant, kind of invasive procedure. So if you can just get a blood test, even like before symptoms are even a problem, like you're just this is a marker that we found in your blood, so you can take action now and maybe avoid this whole thing or delay it 10 years or there's a lot of hopeful information to be had just from that blood test you know. Is that widely available yet? Can we do
There's
that
a
yet?
lot of push towards it. It is relatively available in traditional Medicare. There are two FDA approved blood tests. One is a rule out test in primary care, and one is a rule in test in neurology. So there's still a big debate on, are primary care doctors equipped to use these and diagnose specific Alzheimer's disease, or is it best to test and build up your evidence package and then refer to a neurologist who is more likely to have an understanding and skill set on the anti-amyloid therapies, which do cause, do need some monitoring. So unfortunately, the insurance is slower to adopt these things. They're so brand new that the test just got FDA approved in 2025, and it usually takes at least 12 months for an insurance team to look at the new evidence, evaluate their policies, and update their policies. So we're hopeful that during 2026, we see some first moving insurance companies add these into their policies. They're available direct to consumer, but likely too expensive. They're available through programs are offering some financial assistance. And so they are being done, and it really does improve care. And right now, they're approved for symptomatic populations suspicious of Alzheimer's disease.
All right, good to know. It's good for our listeners to know too. So let's shift gears a little bit and tell me what's happening from a policy lens at the state and federal levels. I know you're in Washington, D.C., so you must have a lot of firsthand knowledge.
It's been fun to get involved in the policy scene. I've been on the periphery in the insurance and the startup world, and so to understand a little bit more about how legislation gets made, it is daunting for sure. These things move slower, and certainly the advocates that have been in the field forever, they can tend to get a little bit frustrated with the pace of change. But luckily, the scientific and the technology change is moving so fast that the policy and the social change has to eventually catch up. And so policy, I think, offers great guardrails of how industry can operate. And what we're looking at now is looking to where you had mentioned on pre-symptomatic, asymptomatic populations of screening Alzheimer's. There are two trials right now in clinical trials to use these anti-amyloid therapies for earlier and earlier stages of disease. And it's a kind of remove the amyloid and then you'll delay symptoms. So if you're too far progressed into the condition, they're not as effective. So the biggest impact is earlier. But it's very hard to catch those people earlier, and certainly the cognitive assessments that we have today are not sensitive enough to catch those people. A blood test would potentially. However, for the reasons we're in this mess, Medicare does not cover prevention and screening services. They need other guidelines to tell them that, yes, this screening is mandated as standard of care, and therefore we're going to pay for these type of screenings. Cognitive impairment has been left out of the game because there was nothing you could do from a medical standpoint. You can do a lot of social good, but from a medical intervention standpoint, there was no tools in the doctor toolkit. Now with the medications, that is moving the ball forward on these asymptomatic, early symptomatic patients. And so there's an act right now called the Alzheimer's Screening and Prevention Act, ASAP, which you need a nice acronym so people know
I
what
love
to
that
do.
acronym.
The charge is we need this ASAP. And that would allow a screening test in 2028 if a therapeutic was approved for asymptomatic and pre-symptomatic populations. So that is exciting and getting traction. The other thing to consider is how can we have workforce protections and societal protections for someone diagnosed with Alzheimer's and other dementias within their career or in the workplace or in general. And so that is some of the real hesitancies to getting a diagnosis. You may, in some states, need to report it to the DMV, and they might be quick to take away a license when that's not appropriate. Or a employer might be quick to reduce your job description because they're not sure you're up to that level of responsibility, and that might be inappropriate. So some of the things, especially that can happen, is if you are under 65 and are filing for disability because of your cognitive impairments, it takes a long time to get Medicare coverage, up to 2 years for Medicare under 65. So there's an act right now called the Bridge Act, which would allow people diagnosed with young onset Alzheimer's below the age of 65 to expedite that 24-month waiting period to get coverage. We saw ALS have success with that pathway, and so they're trying to follow the same pathway there. So that could be a good safety net for them. And then the other thing is early detection and screening in annual wellness visits. So as you turn 65, you might have been advertised to get your annual wellness visit each year, and we all do encourage that. And you may think, did they test my brain? Did they test my cognition? And unfortunately, today, Sue, the standard of care is observational. So a doctor can say, well, they made it here on their own two
Mhm.
feet. They kind of, I think they're talking to me. They might know what day it is, year it is, month it is. Good on the cognitive test. Is
Yep.
that good enough?
Yeah. And they show up, looking good on doctor day, they're cleaned up, they're kind of optimized for the visit. So yeah, you see the bright and shiny version
You
for
might see
people a
the
lot of
bright and
time.
shiny version in that 10 to
Yep.
15-minute window. What Medicare would propose in this Change Act, it's called, would be encouraging use of a validated cognitive assessment. So, as simply as using an actual mini mental status exam, Montreal Cognitive Assessment, MoCA tests that are simpler to administer, drawing a clock, answering some questions, counting backwards by 7 from 100, spelling the word world backwards. Everybody should start practicing those so they're good, so they're ready to perform. But those tests would allow you to capture a lot more people potentially on that disease trajectory than just observational.
Yeah. And it's going to be funny when our kids are having to do the MoCA and don't know what a clock is. They don't know what an analog clock looks like. Um, are there any state programs that are being emphasized right now?
So states have the power of planning and resource allocation.
Hmm.
And what we encourage, not only in the dementia services, but overall aging in general, are state plans on aging and state plans on dementia. First, you have to get a handle on your population. So, are you as a state able to report how many people have dementia in your population and where they are? And then, can you match resources in that community with communities of higher need? So they do resource planning. It's not as ubiquitous as we would hope, but there are some states leading the charge. Your state of Maryland has a longevity plan out there, which is great. And so we do see encouragement there for the state plans. The areas on aging are funded by the Older Americans Act, which is exciting. And so those are great community-based agencies. So the
Hmm.
more we can continue to show their value, I think that's what this administration wants to see is do we have ROI of where we're investing? Can we see return here? And certainly for these community-based programs, we do see return.
Yeah. Well, wow, Mike, you've really shared a lot of stuff. A Milken Institute is a very involved organization across a lot of, like you said, pillars. I think you bring in the economic, the policy, the health, and the research. So I really want to all the work you do and for kind of explaining sort of a nebulous term, Milken Institute, what it means on the day to day. So I appreciate all the work you're doing, and I want to thank you for being here today because this is really, really important work and a problem that we can solve, and I am determined and hopeful that we will. So,
It's been a pleasure working with you, Sue. We're just getting started. I think, we grapple with this personal responsibility and personal autonomy versus system responsibility. And we really need to say this is a system responsibility. This is not personal failings. We talk about prevention and numbers like 45% of dementias are preventable. When you actually look into it, that's not 100% correct, right? So there's these modifiable risk factors at a system level. If
mhm,
we reduced pollution, if we increased childhood education, if we controlled for, yes, comorbidities, if we controlled for vision and hearing loss, but that's not necessarily a personal failing of yours. It's a system responsibility. And so the Institute is well positioned to bring the players together to say, you are deriving value from this dementia care. It's falling on the caregiver right now, but you as an employer are one potentially hurting from that person getting taken out of the workforce because they have to care for a loved one. So we're encouraging slash mandating you to offer paid caregiving leave. It's not approved
right,
nationwide.
right.
Only the highest level employers can offer that. So if we mandate that, that will allow the people that are receiving the value of the unpaid family caregiving to chip in a little bit and reduce
Mhm.
that intensity and that burden of caregiving.
Yeah, that's another whole big topic there. I'm sure we could get into a little more. Before I let you go, though, the Alliance to Improve Dementia Care, which I am a proud member, tell the group here, like, who are the players that come to those meetings? Because it's a lot of big, impressive names, and I like the diversity of all the stakeholders that you bring because there's so many unique perspectives, and it's such a comprehensive and complicated problem that affects so many different, systems and anyway, tell us about who the members
Yeah,
are.
absolutely. It's been a great thing to have been already established, and I get to not take credit, but just jump in and help it grow as, into its adolescence years. And so we have diverse set of stakeholders from health systems and clinical researchers doing academic plus practitioner research, pharmaceutical companies and diagnostic manufacturers, and advocacy groups, as well as patients with lived experience, their care partners. And so we do, and industry players like banks or other legal systems that also have a say in this. And so we try and bring everyone to the table again to say, you have a piece in this journey here, and this is your piece, this is your perspective. We meet monthly for people to share out what they're working on. If there was a recent publication that came out, if we're just after a big conference and there were new exciting updates, and share out, disseminate information. And we're looking for great evidence-based models that people can expand. And so people are doing great work, and sometimes they take it to their small community and it has impact. We need to show this to the venture philanthropists that I mentioned that would want to then scale this program, or an industry large AARP type of player, or the Alzheimer's Association that needs to know about this so they can continue to grow that great impact. So it's been fantastic so far. It's hard to keep us focused and narrow when we want to go wide. And so, right now we're trying to focus on the risk reduction, accurate diagnosis, and getting payers to cover comprehensive dementia care.
Yeah, it's just truly, truly impressive effort. And anyway, I've really enjoyed being a part of it. So anyway, thank you, Mike, so much for being here today. Is there a way that people can find out more about the Milken Institute?
MilkenInstitute.org, Future of Aging, and Alliance to Improve Dementia Care. I was lucky enough to help author two papers last year that if you're interested in diving in and learning more, one is called Mind the Gap, Improving Dementia Care in Health Span. So that came out last August, and that touches on the brain span as an important piece of that. And the other is a business case analysis looking at the business case for dementia care, working with health systems. And really, it's a value-based approach. You can imagine that the services and doing fee-for-service dementia care is not so attractive. That's why it hasn't had widespread adoption. So as we push value-based care to say, no, you get credit for saving under the whole pie of services, that is what we're seeing is more enticing to systems. So I would encourage you to check out those two. This year, we're working on blood-based biomarkers. So we'll have a paper on practical strategies to implement blood-based biomarkers coming up soon.
Wow. Awesome, Mike. Well, thank you so much for being here today. Appreciate all your time, and I hope to see you soon.
Thanks, Sue.